going to change our structure this morning, and we will have our song following our speaker and our regular business meeting following our speaker. So at this time, we'll move right into our program, and I'd like to ask Bill Wooldridge to come up and introduce our speaker today.
Good morning, Rotarians.
Good morning, Bill.
It is with great pleasure that I introduce Bill Considine, a friend and a person I greatly admire. Bill has been president of Akron Children's Hospital for over 36 years. He is one of the longest-serving hospital presidents in our country. Bill has developed a culture at Children's where all children are treated as if they were our own. Children's is mission-driven to provide the best possible health care, regardless of the ability of the parent or patient to pay. Today, Akron Children's is the largest pediatric provider in Northern Ohio, and Bill is nationally recognized as an advocate for children's health and well-being. Please join me in welcoming Bill Considine, President and CEO of Akron Children's Hospital.
Well, good morning, Rotarians. Good morning. It's great to be with you today. And I would like to just acknowledge my friend, Bill Wooldridge. Bill has been a member of the Board of Trustees of Akron Children's Hospital for over 30 years. He served as the chairman of our board at a very critical time in our history and is still incredibly involved. He chairs our audit committee, is involved with our finance committee. He and I will be at a strategic planning committee later today. And what is beautiful to see is the time he devotes to this, the talent he brings to the table, and the way he shares his knowledge and expertise in the advancement of our meaningful mission. It's also always a pleasure to speak to Rotarians because of the values and beliefs that each and every one of you embrace. From a children's hospital perspective, we value our relationship with the Rotary group from around the country. In fact, I know Ken Fogel has spoken to you about the Gift of Life program through International Rotary. Akron Children's is a player in that game. In fact, we have a young man right now at the hospital that has joined us from Haiti. He just had a very complicated surgical procedure, a heart procedure done in our place. I'm very pleased to report he's doing incredibly well. He's recovering here in the States, and he'll be going back to his homeland outside of Port-au-Prince in a matter of a couple of weeks. In addition to that, we've had several, because of your support, several men and women from Haiti that have spent 2-3 weeks here at our hospital learning various techniques so we can do procedures on the children in their hometown right outside of Port-au-Prince or in the St. Damian's Children's Hospital that we're working with. So it is something that we know touches a lot of lives, and those are the kinds of programs and partnerships we love to be part of, and Rotarians make that happen in a very, very positive way. My wife and I also are looking forward to this weekend. We're the honorary chairs for the Akron Rotary Camp Regatta on Saturday night. Again, it is a phenomenal program in terms of providing services to special need children and giving them an opportunity to enjoy a camp setting during this beautiful weather that we're all enjoying. So on Saturday night, we're going to be raising money for the Akron Rotary Camp, and we're looking forward to making it a very successful night. I know a few weeks ago, a real dear friend of mine spoke to you, Patty DePompe. I've known Patty for a number of years. She's a wonderful woman. She's done a phenomenal job being there for families in her capacity at Rainbow Babies. So I don't want to repeat a lot of what I'm sure she shared, but I would like to give you a few ideas of the resource that's been developed at Akron Children's Hospital and how we're trying to position ourselves to be a real important player relative to pediatric health care in the future. You know, 2015 is a very special year for your Akron Children's Hospital because it's our 125th anniversary. And when you pause and reflect on the wonderful journey that's played out over those 125 years, it does give you a chance to rededicate yourself to the important components of the mission that's made that organization successful over that period of time. but also to celebrate a little bit, and then to bring even more people to the choir that can be real voices and advocacy for the children of our region. When you're talking about our 125-year celebration and anniversary, it does really benefit to think a little bit about how we got started. And we got started back in 1890 because two groups of women that were associated with two local churches understood the importance of service above self, a phrase that I know that rings true with Rotarians. They knew by providing service above self, they could touch a lot of lives, enhance their own life, but even more importantly, do things for others. And their idea was to open a nursery in downtown Akron, a place where families could bring their child instead of taking their child to work with them. So they found a home that wasn't being lived in by a man by the name of Colonel Perkins. He was one of the entrepreneurial founders of the Akron community. And they knocked on his door and they shared their idea. He was an investor in a couple of manufacturing plants in the community, so he knew there was a problem relative to children being brought to factories by their parents. So he thought the idea of a nursery made sense. In a lot of ways, it was daycare before its time. So he donated the first floor of this grand house that he wasn't living in. And they converted it to a nursery. And when you came in through the doors and came to the reception desk, they had put 3 promises on the wall behind the reception desk. Promise number 1 is, as Bill said, we promise to treat every child that comes to these doors as if that child's our own. Promise number 2 they had on the wall was we promise to treat you the way you'd like to be treated. And promise number 3 was we promise never to turn a child away for any reason. And back in 1890, the reason wasn't financial, because they charged a nickel a half a day and a dime a full day. But the reason was there was racial tension in town, and they wanted to make sure that the Mary Day Nursery, which is the name they put on the nursery, they wanted to make sure it was open to all children, regardless of the color of their skin. So with those promises and that value system that was put in place, the Mary Day Nursery opened, and it was a phenomenal success. Early in its operation, a child was presented that needed more than nursery care, though. And the child was sick, needed medical intervention. So the volunteers that were there, the women that were part of the volunteer corps, figured, okay, if this was our child, what would he do? We'd try to find a physician to come and see if they could help this young man. And indeed they did that. A physician intervened, the child got better, and word of that spread back to the factories. So guess what? They were inundated with kids that were coming to the Mary Day Nursery that needed medical care, not nursery care. And they went back to Colonel Perkins, said, you know, you have a second floor of this grand house. Well, there's a big old room up there where you used to have your parties. We could turn that into an infirmary, put cribs and beds along the walls. We could take a couple of the bedrooms up there, turn those into treatment rooms, operating rooms, and before they knew it, they were running the Children's Infirmary and Mary Day Nursery. Now, they didn't have Joint Commission on Accreditation of Hospitals to worry about or hospital licensure, but you know, they had something going for them, and that was a very caring spirit, a very caring heart. And they were off and running. You know, I enjoy telling that story because there's a lot of life lessons that you can take from that story. One is the power of volunteerism, because these were volunteers that stepped forward. The power of collaboration, working together to do something as a group you can never really do on your own. The whole spirit, again, service above self. And when you put all that together, there's a secret sauce there. There's a magic to all that that really benefits the community, enhances all our quality of life. So we tell that story at Children's on a day-to-day basis. From that early beginning, we've had quite a run. Today, your Children's Hospital is much more than just a hospital. It's an integrated pediatric health care delivery system that believes in collaboration, believes in sharing the resource, the investment that's been made with anyone that can benefit from the pediatric expertise that we've put together. Our integrated pediatric health care delivery system is also independent, because we know by being independent, it gives us an opportunity to work with adult systems that might be competitors with one another. And if we haven't joined one to the exclusion of the other, we can work with both of them and again touch a lot of children's lives. And because we have that independence, we've been able to continue to invest and grow. And now we're the largest pediatric healthcare delivery system here in Northern Ohio. I was looking at some statistics just the other day, and in 2015, we've already seen a patient from every state in the U.S. that have come through our doors to benefit from the services we've been able to develop. We're 2 campuses. We have the Akron campus and we have the Mahoning Valley campus over in Youngstown. We've been in Youngstown now about 8 years, and we have a robust pediatric program there with now 600 employees that are in the Youngstown marketplace. We also have 26 primary care offices. And those are places where you can take your child into a primary care setting. We have a wonderful office here in our Hudson community. And we continue to invest in these primary care offices with employed pediatricians that are there to see a child close to home. We also have a relationship with about 24 adult hospitals where the Akron Children's name is on either their pediatric unit or their special care nursery. Again, so we can bring our health care and the services for children closer to the homes of those children. We just opened 2 more primary care offices in Warren, Ohio. The St. Joe's Hospital that's in Warren, their special care nursery now has the Akron Children's name on it, and their pediatric unit has the Akron Children's name on it. Those same kind of relationships are in play in Worcester, in Norwalk over with Fisher Titus in that community, in Youngstown with St. Elizabeth's, with Summa Health System, with Akron General, and with Cleveland Metro in the Cleveland market. Again, the spirit of collaboration. When you look at our overall services, we have a home care company that's part of our integrated pediatric health care delivery system. My guess is we'll see as many children today in their home as we see as inpatients in our hospital, with our home care nurses going out to the home to just make sure that a child's recovery is going the way that we'd like to see it go, making sure that they're compliant if there's on some type of medical treatment plan that's going to help them gain their health back. But compliance is very important, and our nurses and our aides will go into those homes and work with the families to make sure that everything's going in the right direction. We also have a school health service. We're very proud of the relationship we have with our colleagues here in the Hudson school system. We're in 28 school districts now with school aides and school nurses. It's a program that, as Bill Wooldridge knows, we've talked about it at our finance committee, it's not a revenue producer for us, but it's a way for us to connect to communities and be a partner with the schools. And within those 28 school districts now, 162 school buildings, our school aides and school nurses had contact with some 350,000 children last year while they were in school, relative to a reaction to some medicine they're on. If they're an asthma patient and their inhaler might have had something that didn't go right with it, we can intervene there. Oftentimes keep the child in the school setting and not have to have them leave school to come to an emergency room within the system. We do have about 60 locations throughout northern Ohio where we do have pediatric services being provided, either in emergency rooms that have our name on them, urgent care facilities that have our name, or in concert with some of those adult hospitals I mentioned a little earlier. When you look at the integrated pediatric health care delivery system and you underline the word that we're collaborative, again, as I said earlier, we want to make sure that we're bringing our services and making our services available to anybody that can benefit from that. We really believe that that's a secret to getting our arms around access for health care services for children and also the cost of health care services for children. We are a very mission organization, a driven organization, as Bill mentioned. Our mission has stood the test of time. There are 5 components to it. The first component is that we're a family-centered care organization. We try to design everything with the family in mind. We also have a number of phrases at our place. One of them is we try to design things through the eyes of a child. And when we sit and talk about what a child might see or how a child might define an organization, all of a sudden you figure out that they don't call a hospital room a patient room. They might call it a clubhouse. And if you're thinking about clubhouse, you're going to design that patient room a lot differently than you would if you had physicians and a nurse and an administrator designing a room. If you put a child around the table and you talk about a clubhouse, you're just going to make it a much more interactive and an imaginary space, which actually helps the healing process. We utilize our parent mentoring program and our parent advisory committee at the hospital to look at all our rules and regulations that we do. We just put up a brand new parking deck at the hospital about 2 years ago, and when we were designing it, we had the parent advisory committee work with us, and they pointed out that most parking decks you go into, the spaces are getting more narrow and more narrow and more narrow. And when you pull in with a SUV or a van, and then you have a child, and you got these strollers today that look like Cadillacs, it's hard to get all that out of the car and then get the child in. So we sacrificed about 150 parking spaces in the deck to make the spaces wider. And hopefully that'll enhance the patient experience, the family experience. And it was done because of the input we had from our parent advisory committee. Listening and learning is something that is extremely important relative to everything we do. The other thing within that family-centered care philosophy is we know that there's no time for a bad hair day at Children's. We can't make our bad hair day that of someone that just came through our doors, has been told their child has a debilitating disease. I mean, I might have come in, my computer's not working, I might have had a hard time finding a parking space as an employee, but I can't take that out on a patient that I'm interacting with at the registration desk or up in one of our clinical areas. So we're always trying to make sure that we look at things through the eyes of the people coming into our organization, and we want to make sure the eyes that they see when they look at us are ones that are caring eyes, and that we have a heart that's open to embrace them and make sure that their experience is a good experience. And that's what family-centered patient care is all about. Another component of our mission statement is that of education. Akron Children's had the first nursing student in the city of Akron back in 1904. The first resident in the city of Akron happened to be a pediatric resident. His name was Dr. Noah Miller. He was a resident at Children's back in 1917. And we just know that when you have the opportunity to take care of patients, you want to learn from those patients, but you also want to make sure there are caregivers in the pipeline to follow us. So you can have a robust program and you can continue to see the investment that's been made in pediatric health care, make sure that grows, and you do that through good people. Woody Hayes always said you win with good people. We know that, so we really want to make sure that we are viewed as a good coach too. We've all had good teachers, we've all had bad teachers. I know personally I've had some very good coaches. In my days I've had some very bad coaches. We want to be known as a good coach, a good teacher. And again, you need to listen and learn from those that are coming through. You take that feedback in a very positive way, and you're constantly changing. We know that status quo is our worst enemy. We know that our work will never be done as long as there's a child out there that can benefit from the investment in pediatric health care. And you really learn that, and you can build on that through your educational programs. We have invested heavily in our residency program where we're training tomorrow's physicians. We have now 11 fellowship programs that are really focused on some research and other activities that really help develop young men and women into specialists along the way. We have a number of nursing initiatives that tie us to the 5 or 6 nursing schools here in Northern Ohio. And on any given day, there can be upwards of 1,500 young men and women that are getting an educational experience within our children's enterprise. And education is just something that, again, because of our board and the alignment we enjoy with them, they're willing to continue to make the investment that needs to be made if you're going to be in this educational business. We also believe in discovery and the research component of a hospital like ours. We'll see this year 900,000 children through our clinical programs. 900,000 children. And when you just think about the information you can gain from the various ailments that they're bringing to the table, when we can look at what works, what doesn't work, how you need to modify some care plans, when you do that, again, you're raising the bar. And if you also are willing to share your information with other pediatric providers like Rainbow Babies and the folks at the Cleveland Clinic and the people around the country, you really, again, in a collaborative way, enhance the care and raise all the boats. And our discovery and our research initiatives at Children's are something we're extraordinarily proud of. Our Board of Trustees puts a lot of emphasis on quality, and they should, because quality is how we're going to be measured. And our most active board committee at Children's is our quality committee. And when you see the alignment that's in play between our medical staff, our parents, the administrative team at the hospital, as well as our board, they're all together. People are not trying to hide a mistake when it occurs. When a mistake occurs, we want to learn from that. We want to be very transparent. We want to be open and talking to the family about it. Oftentimes, we've actually had family members that have been in a situation where things didn't go the way they should, and we want to hear their experience. We want to hear the anxiety and the frustration they went through, because that's how you learn, that's how you make yourself better. Because we've been able to do that, we've reduced a lot of our quality measures and enhanced those dramatically. Adverse drug events, we reduced those considerably. Codes that occur outside our ICU, we reduced by 86%. Surgical site infections in many of our areas, we've had 14 months where we haven't had any infections in shunts that have been applied by our neurosurgeons and patients. And the families benefit from that, the child benefits from that, and going back to that initial promise, treat every child as if that child's your own. And when you can do those kind of things, we believe we're really meeting our mission. Another component of our mission statement that we talk about a good bit is community service. We work with churches, we work with schools, we work with any organization in those 60 communities I mentioned earlier to try to be there for a child that needs the benefit of the services that we can provide. And that spirit of collaboration, that community service, being part of those communities is something that has been part of this hospital for 125 years. And then the next component of the mission statement that we talk a good bit about is child advocacy. Children don't vote, and people like us do. So we need to be aware of the issues that are out there that affect children in the public policy arena and talk to our elected officials about that. A lot of people are surprised when we tell them that the #1 insurer of pediatric health care in this country is Medicaid. 50% of our business at Akron Children's Hospital is Medicaid. Medicaid is by far the largest insurer of pediatric health care in the United States, yet it's a program that is changing dramatically. It's viewed by the general public as a welfare program. The Medicare program is not viewed as a welfare program, but Medicaid for kids is no different than Medicare for all of us. So we are constantly trying to educate our elected officials about what Medicaid means to our children. And the other program, well, the component of Medicaid that's really now causing some concern is with the growth of the Accountable Care Act. More and more people that now are under that 138% poverty level that are adults between the age of 21 and 65, they're coming onto the Medicaid logs. Already on the Medicaid logs are our folks, our citizens that live in nursing homes. And when you look at the growth in Medicaid expenditure in this country, it's really tied to those two issues. It's tied to the growth of people in our nursing homes. It's tied to the incredible growth in pharmaceutical costs in nursing homes. And it's tied also to the growth of the people that came onto the Affordable Care Act that now are at that 138% of the poverty level. The children are still accounting for about 60 to 65% of all the people on the Medicaid logs, but the amount of money that are going to those children continues to get ratcheted down and down. So we don't want to pit children against adults by any stretch of the imagination, but we really do want to make sure that children get their fair share. And one of the things that we're working on is to try to maybe spin children out of the Medicaid program into another program that would be very focused on them. And that's what advocacy kind of brings you into when you start really delving into the public policy initiatives and the way healthcare is financed in our country. Speaking of healthcare financing, there were a few things I did want to just say before we open it up for some conversation or questions. We're trying to position ourselves for the future. We've been around for 125 years. You heard me say already the status quo is our worst enemy. We know that we want to be architects of the future relative to pediatric health care. And we believe one thing that could really help is if we went into an area called population health. You've probably heard that phrase. We define population health the following way. What we'd like to be able to do is have an agreement with the state of Ohio. We can start with them to take responsibility for 500,000 children's lives in the Medicaid program that are in our catchment area here in Northern Ohio. So we already believe we have the responsibility to care for those Medicaid children. We also believe we already have the risk relative to having to do insurance contracts with the various payers that cover those children. We'd like to simplify the program where the state would direct contract with us and pay us a per child per month rate, and then we would take the risk to make sure we did everything that needed to be done for that child relative to their health care during the course of the year. We would make sure the child had a medical home in one of our primary care offices, and that's why we've been investing heavily in primary care. We have 26 offices now. If I'm speaking to you next year, we'll have over 30. We're going to continue to try to add 3 to 5 offices a year to get up to maybe 50 pediatric primary care offices here in the region. So every child within that 500,000 catchment group would have a primary care office where they would get their immunizations. If they had something happen in the middle of the night, they wouldn't have to go to an emergency room. They'd have a contact information relative to their medical home. Would also follow those children in the school settings. That's one of the reasons we're investing heavily in our school health service. And we would work with those school districts, we'd work with the teachers and others to make sure that if there were some compliance issues relative to a child that's a diabetic, we'd hopefully make sure they're getting the right diet in the school setting, right exercise in the school setting, to avoid, again, a hospitalization or emergency room visit. And then if they did need to have care in a facility, if they came to the ones that had the children's name on it, we would basically pay ourselves. If they went somewhere else, we would pay that other entity. I know at the end of the day, we could control cost, healthcare costs, considerably better than what's being done now. And quite honestly, we would have a better bottom line within our enterprise, and those dollars could then be invested in additional services. So that's one of the things we're trying to position ourselves for relative to the future. Relative to the present time, our volumes and the demands for our services continue to grow. We've been very successful in recruiting. I was just sharing at breakfast. Tomorrow I'm having lunch with 12 physicians that are new members of our employed group at Children's. At the end of the year, we'll have probably brought on another 62 total new physicians to our medical staff. And that's on top of the 50-some we brought on last year and the 50-some we brought in the year before that. Just building depth in order for us to take more services out into those 60 regions that I mentioned to you a little bit earlier. We just finished a wonderful investment on our Akron campus known as the K. Jeweler Pavilion. It's a 366,000 square foot building. Again, through the eyes of a child, they really labeled the top 2 floors as treehouse floors. So there's a little treehouse theme relative to the top floors. It's our brand new neonatal unit. It's a 75-bed unit. Yesterday when I gave a tour, there were 72 patients in that 75-bed unit. We have a new service that we're bringing into that tower for special deliveries. So moms that have a child that has special needs that may need surgery right after delivery, we'll have a facility for them in this new tower. We also have a brand new outpatient surgery area there. We're doing about 16,000 surgical procedures a year. Our current operating rooms that did both inpatient and outpatient surgery were very, very compacted. We've tried to free that up a little bit and did so by creating a brand new outpatient surgery area, which now is enabling us to do some renovation in our inpatient ORs for advanced neurosurgery services and interventional radiology. We also have in the new tower a brand new emergency room. Our emergency rooms see about 100,000 visits a year, and the emergency room on the Akron campus usually does around 65,000 of those. So those are investments we've been able to make. We believe in bringing best practice to our administrative operations. We're very invested in Lean Six Sigma at our organization. We have been doing that for almost a decade now, and we used a program known as Integrated Project Delivery for the 366,000 square foot K. Jeweler Pavilion I mentioned. And to give you an idea, and then I'll wrap up, when we first looked at that building in the traditional way, we put pen to paper and we said, okay, we're looking at about a $240 million new facility. We knew that by using value engineering and other kinds of vehicles we've done in the past, we could ratchet that down to about $210 million. Well, then we said, let's use this integrated project delivery methodology that we've never used before with any of our building programs, but it's a Lean Six Sigma concept. So we were able to get some warehouse space out in a warehouse district in town, and we literally built out every floor, 60,000 square feet in cardboard, and had families and had staff and had vendors and other folks come out. And we had the architects with us, we had the contractors with us, and we looked at like the 7th floor, and we remodeled it with cardboard and not with cement. Then we did the 6th floor and the 5th floor, and we really programmed the entire building in cardboard before we ever put a shovel in the ground. When we got done with the cardboard modeling, the team, not me, the team set a target price of the new building at $180 million. They brought it in at $176 million. That's Lean Six Sigma. And the money that we were able to save, the $30-some million we were able to save in that, by going in that kind of discipline, is money that we could invest right back into pediatric healthcare services and advance that vision of being a population health entity over the next several years. So it's a wonderful journey. I've been blessed to be part of a children's team that enjoys the alignment and the positive energy. There's not a day that goes by that I'm not inspired by the strength and courage I see with the children that are there dealing with what they deal with. I've been amazed when I see a 5-year-old become the caregiver for their doctor, become the caregiver for their parents and their siblings, because they know what God has in mind for them, and they want to make sure that they can make their parents and others accepting of that. It is a very humbling and inspiring thing to see on a day-to-day basis. I know my colleagues at Hattie Larlam can speak to that too, but we're in a special community, folks, and one of the reasons it's special is because of Rotarians and people like you. Thank you very much for what you do. God bless all of you. Thank you. I'll be glad to answer any questions. Yes, I see a hand.
Bill, I belong to a group called Mended Hearts. We call on open heart patients, but adults. It's my understanding that there is another group called Mended Little Hearts, and I don't know, I'm not aware whether that group is in the hospital or if you might be interested in us trying to establish a group like Mended Little Hearts.
My understanding is we have had some interaction with Mend of Little Heart, but I'd have to get a little bit more information for you, but why don't we share contact information, because I know how families really appreciate you know, people that care about what they're going through. And that'd be a wonderful offer. Thank you.
Thank you.
Sure. Any other questions? Oh, yes.
I read that there are 91,000 shortage of physicians by the year 2020. How many pediatric physicians are going to be short? Do you have an idea?
Yeah, one of the questions is, you know, some of the projections are we're going to have a pretty severe shortage of physicians down the road, and those are accurate estimates. What it gets to be a bit of a challenge is some of those shortages are in rural areas. Certain urban areas, you have plenty of physicians. At Children's, we're really trying to build depth in our primary care practice first, because we do believe that within the whole financing of healthcare, that primary care doctors are going to get dealt with more fairly than they have in the past, because they're gatekeeper, they're the front person. I mean, there's a lot of primary care physicians that are dear friends of mine that have been in private practice, but when they don't get reimbursed for, and when they lose money on giving a vaccine to a child, that just doesn't make sense. When they, you know, have to freeze their own salaries for a period of 5, 6, 7 years because they're in private practice, that makes it very difficult. And that is one of the reasons we're employing more and more of these men and women, because we don't want them to leave the community. So we now, when Bill and I were talking over breakfast, when I joined Children's in 1979, I think we employed 2 physicians. Today we employ over 500 physicians. And it helps because we can go in negotiating with various payers now and give them a global price. And we want to make sure that our clinicians are rewarded appropriately for the services they provide. And we just don't pay them on paying patients either. We take all patients. If you went to one of our units right now, you couldn't tell by looking at the chart who's a self-pay patient, who's a Medicaid patient, who's a Blue Cross patient. You couldn't tell because they're all children. And that's how we want them to be viewed by our caregivers. One of the areas, you know, there are certain specialists, I think pediatric neurosurgeons, there's only about 12 of them that come out every year for the entire United States. So recruiting for pediatric neurosurgeons gets to be very, very competitive. We're very fortunate. We have 2 women pediatric neurosurgeons that are fellowship trained. One came through the Cleveland Clinic program, one came through the Johns Hopkins program. They both had offers from around the country. They're here at our shop, and they're phenomenal folks. There are interventional radiologists that are pediatric fellowship trained, are scarce as hen's teeth. And again, we were able to recruit a woman to join us. Women are taking over our place, by the way, in case you're wondering, which is a good thing. My wife tells me it's a good thing. Other questions? I saw one other hand.
More a comment than a question. My wife served on the Parents Advisory Council for about 14 years, and her experience on the quasi-inside was phenomenal. Everything you say is absolutely true.
Well, thank you for sharing that. You can tell her we've learned so much from our parents. You know, I've been on the other side of the healthcare too, and with my dad and others. And when you see things happen and you know that could be done differently, you got to make it happen. And our Parent Advisory Committee has made our place a family-centered place. But our work's never done. Because you got everybody, you want to treat them one at a time, and you want to learn from every one of those experiences. Well, thank you very much. Really appreciate all you do.
Thanks, Bill, for interrupting your schedule and getting here bright and early this morning, and thanks for the good work that your team does. So we're going to move into our regular program, and we will start with Dick Pearsall, and we'll have our song. We can't have a Rotary meeting without a patriotic song.
After I saw the announcement, I didn't know if there was going to be any singing today. But I think this man and Akron's Children's Hospital is an example of what a wonderful country we live in and how fortunate we are to have that facility. So I just think we'll, without any more, and we don't have any arrangement, we'll just sing America this morning. So here we go. My country 'tis of thee, sweet land of liberty, of thee I sing. Land where my fathers died, land of the pilgrim's pride, from every mountainside, let freedom ring. Okay, thank you.
Okay, thank you, Dick. Okay, we have a few guests here today, and I'd like to introduce them. Back for a 4th or 5th or 6th time is Matt LaFountain. So Matt, would you just stand and be recognized, please? And we have 3 guests that are here the first time, and I'd like to ask them to come forward, please. We have Casey Marks, Jeff Brooks, and Mary Kate Gladstone. Would you please come up and be introduced? Okay, we'll start, since Mary Kate is here, we'll start with Mary Kate. Mary Kate is a lifelong friend, her lifetime, not mine. And Mary Kate is a resident of Hudson, a neighbor, a graduate of Walsh Jesuit, a recent graduate of Xavier University in Cincinnati, majoring in communication studies. Mary Kate's here today because her goal is to pursue a graduate studies in child life and work in a setting such as Akron Children's as a child life specialist, and you've learned today how important that kind of a role is. Jeff Brooks, a guest today in the middle there. Jeff is a CPA. He's the tax manager at Apple Growth Partners, and we're glad to have you. Casey Marks is with PNC Bank, where he works in private wealth. Is that
private banking?
Private banking, and Casey, in Casey's spare time, he coaches children's soccer. So, welcome. Thank you very much for attending. Go back. Okay, so moving in, Gail Royster, our 3-minute Rotarian for today.
Good morning, Rotarians. Well, being in the real estate business, I thought I would do this pictorially and do it by showing you different houses that I have lived in. So let's see if this is going to work, Bella. You do the right side? I don't know if it's on. How do you turn it on? There we go. Okay, this is our first house in Ohio. This is in Shaker Heights, and this is where we were very involved in St. Dominic's Church. I have 4 children, so they went to St. Dominic's and the public schools and university school as well. Next, we decided to move to the country, so this is in Chagrin Falls, and actually just over the county line into Geauga County. So my kids all graduated from West Geauga High School. What was interesting about this house, it was a spec house, spec meaning a builder had built it intending to sell, but he didn't finish it. And so when we bought it, there were 14 liens against the property. This is before I was in real estate. So this was quite an eye-opener as we hired an attorney and spent 3 months negotiating after we had moved in, because we had already sold our house in Shaker. So we moved in without any floors, you know, no appliances, but life goes on. So from there, we moved into the heart of Chagrin Falls and had this home built by Snavely Construction. There was a knock on the door about 5 years after we had moved in. This was a new development in Chagrin and very popular development. Knock on the door, somebody wanted to buy it. And we said, okay, but give us 6 months. So 6 months is a long time for someone to wait to get into a house, because we were building, this house, and I'm sorry it's so blurry, it's the only photo I could come up with. This is in Canterbury Place, and we built this with the idea of curving it around the lake. So there's actually 3 setbacks there. You really can't tell from the photo. And I was already working in Hudson at that time, so that was my goal, was to be on water. From there, what? We built that in '87 with Hal Dillman. Then we built this house in the center of town, and that house was one of the primary victims of the 2003 flood. This is where that house is on a slope, and the entire lower level, which was at grade, walkout at grade, 3 sets of glass sliders down there. That flood water forced all of those doors up against the back wall. So our entire lower level was absolutely wiped out. We had a kitchen, second kitchen down there, bathroom, bedrooms, etc. 2,000 square feet down there. So that was quite an experience. Then, look at that, bought that. People thought it was nuts. What are you doing, Gail? Really? You bought that? This is on Manor Drive. Peter knows. Just nothing done to it in 50 years. just a plain old wreck. So I like to turn lemon into lemonade. So that's the same house. We totally gutted it, and it wound up on the Home and Garden Tour in, I think it was 2010 with that. And I think most of you know I love my gardens and my ponds and all that sort of thing. So this is the result of turning lemon into lemonade. And then I landed, oops, Ed's not here, but I now live in there, the hood, as he calls it. This is the Villas of Hudson. This is my condominium. And of course I had to gut that too. So took out ceilings, walls, added skylights, and in a couple of weeks I'm going to tear out the patio and walkway and put beautiful gardens in there. Business. I actually came to Hudson to manage the Smythe Kramer office. This is a very old clipping from the hub, but in the window there I had 4 musicians playing, the string quartet from the high school, and this was to celebrate the complete remodel of the building. And I have to say, it's pretty much the same as it was then. That was 1989. Then Bob, where are you, Bob? Bob was my landlord here for Royster Realty. Also had a building company in the 90s, and we bought a bunch of lots down on Stratford and Brentwood area where the train is. Well, you can't hide the train, so we just called it Stratford Station. And my partner in that was Dick Spurney, who's a resident here now, wonderful longtime friend. Then merged in 2013 into Howard Hanna. So they had a lovely reception for us at Country Club of Hudson. Oops. And I just listed some of the professional associations and volunteer work that I have done, but the most important one to me has been Rotary. I've been in Rotary since the 1980s. This is, I'm being inaugurated as president here, and it looks like he's going to whack my wrist, but the gavel is being passed. And then the right-hand picture shows, where are you, Tom? Tom, presenting me with wonderful, wonderful flowers. And that's it, guys.
Thanks, Gail, for that entertaining and unique presentation. So next week, our 3-minute Rotarian is Dan Williams, but I'll draw a name out of the box for the following week, which would be October. George, it's you again. Are you going to be here? Yeah, I will be. You will be here first week of October. Good, George Snyder. Okay, good. So now moving on, a few weeks ago, we had Cheryl Warren here, and talking about the good work that Rotary does. I think it was Phil Tobin that had a question about End Polio Now and where we stand on End Polio Now. And I've asked Evan McCauley to prepare a little summary about where our End Polio Now initiative is at the moment.
Dr. Evan. Hit it, Bella.
Ladies and gentlemen, 2 years ago, the largest country on the Asian subcontinent was still infected with polio. 2 years ago, skeptics and cynics around the world said this country proves polio can't be eradicated. Ladies and gentlemen, today, India is polio-free.
It's a matter of satisfaction that we have completed 1 year without any single new case of polio.
Ladies and gentlemen, a polio-free India is a magnificent achievement, and it is Rotary's achievement.
Rotary International is one of the key partners in the polio eradication efforts around the world.
Well, without Rotary, this polio campaign wouldn't be anywhere. And the incredible effort that's been made from the very beginning is really unprecedented.
Over the past 24 years of our partnership, Rotary has proven again and again that its 1.2 million Rotarians in 33,000 Rotary clubs in 170 countries around the world are much better than us, your partners, when it comes to the political and the societal challenge. You are better at convincing political leaders to hold local authorities and vaccinators accountable. You are better at convincing donor governments of the value in investing in polio eradication. Your voice, Rotary's voice, is the most powerful weapon we have in the war against polio.
We have the resources at hand in the world to tackle the problem. It's just the will and the money to be able to continue the fight. But it's totally doable.
I can see a great chance of success, but without redoubling the efforts, I know it won't come easily.
You have convinced the world's health ministers now that the completion of polio must be declared an emergency for global public health. Your core partners are all going into emergency mode.
If we back off now, the problem is going to get bigger and it's going to be even more expensive, especially if it spreads to different countries. It is a preventable disease. To give up on trying to eradicate a preventable disease, I think, is immoral. It's really almost unethical.
Rotarians, make the case for full financing of eradication. Write to your governments, meet with your ministers of international assistance. Make sure your government knows how generous you, Rotarians, have been and challenge them to match you.
You can't think of an organization that's put its reputation on the line and taken all of its capabilities, having volunteers, having a voice about the importance. It's really an unbelievable thing.
It would be a huge, huge public health achievement to eradicate polio from the face of the earth. And you can do it.
Today, Rotary's vision of a polio-free world is much, much closer to reality. The world is declaring the completion of polio eradication in these last few countries an emergency for global public health because we believe in your dream of a polio-free world. Now, your energy, your advocacy, and your generosity must be the energy that drives this emergency. Rotarians, a polio-free tomorrow is this close now.
In 1985, there were about 350,000 cases of polio globally. So that's about 1,000 new cases per day. In 2012, as we just learned, India became polio-free, and polio was 99% eradicated to where there's about 1 case per day. So I'm going to get to the 2015 numbers, but in the middle I'd like to share the impact that Rotary's had on this fight. Rotarians have contributed over $1.3 billion to the cause. They've impacted government decisions totaling over $9 billion in government donations. And we've helped over 2.5 million children receive immunization through volunteerism and just man and woman power. It's more than volunteerism. So that 1% that we still have, we're this close, but that 1%, that's the tough 1%. That's the 1% up in northern Pakistan where there's armies fighting over this. There's militant groups that oppose vaccinations. So the 1% that we're still at, that's the tough part. And what we're doing here, we're making history. We're going to eradicate polio for the second time in history. and we're almost to living in that legacy. So in 2015, going into the year, there were 3 countries in the world that still had polio: Afghanistan, Pakistan, and Nigeria. In July of this year, Nigeria reached 1 year polio-free. All of Africa is polio-free, and there's only 2 countries remaining now. So where do we stand today? There's 8 cases of polio that have been, there's 8 cases of polio in 2015, 1 case in Afghanistan, and 7 cases in Pakistan. Again, that's the tough 1%, the 1% that armies are fighting for. And as we learned in this video, the best way that we can make an impact and how we can be a part of this history is using our will and our wallet. So with that, Bella, if you could shoot the next video, there's going to be a short 1-minute public service announcement that I'd like to show you guys. There's a download, I believe. It should be open. Yeah, that's it right there. Thank you.
We're this close. This close to making history.
This close.
We are this close.
We are this close.
This close. This close to changing the world. We are this close to making sure no child suffers a crippling disease ever again.
We are this close to making history.
We are this close to ending polio.
This close to ending polio.
We're this close.
This close.
This close to ending polio.
This close.
We are this close to ending polio.
All we need is you.
All we need is you.
All we need is you.
Is you.
We are this close. This close. If we don't act now, we may lose this chance forever. Help Rotary make history at endpolionow.org.
All right, question for y'all. How close are we? This close. Thanks.